number one, we have to know that migration is a choice. And as trade unions, our number one advocacy issue is that migration should be a choice and not forced. So if somebody is leaving the country and the person thinks that his interest is not being taken into consideration and that person is leaving, we will even consider that as forced migration. But if I feel like, oh, I am okay here, but I think I just want to have a difference, that is choice migration. And with forced migration, people talk of low remuneration or bad conditions of service. Others also talk about the fact that they are unable to further their education, or even when they further their education, it is not recognized. And so people have different reasons why they will want to move and settle outside. But I want to believe number one is the fact that some of them don't find good jobs, and others also remuneration issues, and others personal development issues. I want to believe this is a matter that we have to take seriously, because if you have the experienced healthcare professionals traveling out, then you have no choice than to pick the fresh ones. But even in Ghana for today, we have about 3 or 4 batches of healthcare professionals who have finished their education and they are home. They are not getting employment. Who to create this employment? Or who is supposed to make the economy very conducive for businesses to thrive, said that there will be enough employment opportunities for these people. As trade unions, what have we done even to stop this or help with this? Not only in the health sector, but also in the care sector, we see that a lot of people go to the East and the Gulf countries, and we have a lot of problems in there. Most people, when they want to travel, they don't find out who is recruiting me, what kind of work am I going to do, what are my employment conditions. So as trade unions, I remember we put together a document called Pre-Decision and Information Kit. And in this, there's a lot of information in there. But unfortunately, people don't read. And that is a big challenge for us as Ghanaians. We don't read. These documents were made available for free. And we thought that anybody who intends to travel should at least have basic information about the country you are traveling to, who your employers are, what the terms of employment looks like, what's the possibility of me coming back, where am I going to do this kind of work. Unfortunately, because there is no low employment here or very high unemployment, anybody who hears that there is job here, the next minute is, I want to get there. Very unfortunate.